one of the hats that I wear is Director of Women's Mental Health here at Montefiore. And in the spring of 2020, we started to build up a clinical program for women and birthing persons in the Bronx. Access to perinatal or reproductive psychiatrists, with few exceptions, is generally limited to those who can afford to pay out of pocket. Up until very recently, I was the only reproductive psychiatrist in the entire borough of the Bronx, which is actually criminal considering that the Bronx has the highest pregnancy rate of any other borough in New York City. It's also the poorest borough, and it's home to a very, very diverse population. We know that 1 in 13 women experience depression during pregnancy, and that increases in the postpartum to 1 in 7. And these numbers are much higher for women of color, especially Black women, who are a preponderance of the patients that we serve in the Bronx. So in spring of 2020, we launched our inpatient perinatal consultation service at Weiler Hospital, which is one of the 3 Montefiore hospitals. And this is the hospital where we have our high risk labor and delivery service. So we see women who are pregnant or postpartum, who have psychiatric complaints, who are, using substances, who are experiencing depression, suicidality, have signs and symptoms of postpartum psychosis. We really run the whole gamut in terms of the patients that we see. And then through a partnership between the Department of Psychiatry at Montefiore and the Department of Obstetrics and Gynecology, we hired a second reproductive psychiatrist who started with us this fall of 2022. And she is based in a clinic and is able to see women who are pregnant and up to 4 months postpartum who have psychiatric disorders like major depressive disorder, OCD, bipolar disorder, and various anxiety disorders. Another component of our program is training. So we train psychiatry residents through didactics and required clinical rotations in how to provide evidence-based psychiatric care to women across their reproductive life cycle, so from menstruation through menopause. And we also teach OBGYN residents, maternal fetal medicine fellows, and internal medicine residents in key topics in women's mental health. And our hope for this program is that in a few years, we'll be able to build a comprehensive women's mental health center that provides not only psychiatric services, but also providing individual and group psychotherapy, social work and case management, in a welcoming, dedicated space just for birthing persons. And one day we also hope to host a women's mental health fellowship at Montefiore.